The announcement today is that schools will resume at the start of this school year. We're planning ahead. Superintendent Hoffman will release guidance for schools on Monday, June 1st. This guidance has been informed, of course, by school leaders, teachers, parents, and public health experts from the Arizona Department of Health Services. In addition, we're going to have an executive order to support our schools. The superintendent's asked for flexibility around child care ratios for school-based child care programs, so we're announcing a responsible plan developed by health services that will protect children in school-based child care and will allow for increased child care capacity for school-aged children. We'll continue to work with school leaders to ensure the needs of the children around the state are met. In addition, I said that things would be getting back to normal when somebody could say play ball or batter up. I was hoping that play ball was for the Arizona Diamondbacks, but in the meantime, it can be for Little League. Organized youth activities can resume. So whether that's summer leagues, summer schools, or day camps, those are important. We wanted to provide clarity here. There is guidance to allow youth sports to resume safely and responsibly, so please feel free.
This is about schools. You had mentioned it before when you were explaining maybe not interacting with lunches. Does that mean lunches in classrooms, no more lunchroom, no more socializing like that?
So it could mean lunches in classrooms with the cohort of children that they're with all day. It could mean going that classroom, going to the lunchroom and having a shorter lunch period, cleaning up, disinfecting, and letting the next classroom in. But it is going to mean less mixing between classrooms.
Is that going to be district by district decision?
Yeah, that'll be district by district and circumstance by circumstance.
In terms of reopening schools, that they provide a lot more than just education, which sounds like you're making a balancing test that what they provide outweighs the risk of all these kids together. Are we essentially saying the benefits of kids in school outweighs the risk of having the kids together and bringing disease home to their parents?
So what we're saying is that from a public health perspective, schools provide nutrition, they provide safe environments, they provide physical activity. All of this is important for the ongoing health of these kids, especially as they grow. And so we are looking at it from a holistic public health approach. We are weighing it against the risk of transmission of the virus, and that's one of the things that we're taking into account with the flexibility is those kids that may have family members that are high risk, and how do we account to keep them safe while we're still meeting the needs of the children. One of the things that Arizona has done in preparation to ensure that we have ongoing hospital capacity is we established the Arizona Surge Line, and we're one of the only states to have this free 24/7 centralized call-in line for hospitals and their providers that they can call if they've got patients that either need to be at a different level of care, either higher or lower, or a hospital becomes is concerned about their capacity or their ability to care for that patient. This was stood up in April. Over the last few weeks since it's been stood up, we have facilitated the transfers of over 400 patients statewide to the appropriate level of care. This is a real-time call that a hospital just has to make one call, and this line can find where the available beds are, where the available care is, and actually facilitate that transfer, taking that off of the hospital's responsibility so that they can go back to caring for other patients. There's an executive order that that will be released that requires the hospitals to actually utilize this. This actually was a partnership that we worked with the hospitals on. They voluntarily have been working on that and have provided resources to help assist the state stand this up. What it does do is it does require more frequent reporting of those beds so that we have a good idea of what's currently available when we need to find it. And then it will require them to accept patients when it's clinically appropriate and when their resources allow. The other thing that it does is it ensures that the patients who are transferred by no choice of their own, because the surge line is coordinating their transfer, that it will be considered in-network by their insurance provider, because the last thing we want is for somebody to get transferred to a hospital that's out of network and have a large insurance bill.
Let's talk a little bit about returning stronger in our economy. Part of that is taking care of the 500,000 plus individuals who were displaced during COVID-19, the people that were working just a few months before and all of a sudden had no income and no job. We've worked hard to make sure that no one fell through the cracks and that our social safety net was strengthened and expanded. This is the unemployment benefits paid, and you can see the first real date where there was an increase was April 4th, just not that long ago. Over $1.4 billion that's been put forward in just a few months. That's over $983 million in unemployment benefits. In terms of pandemic unemployment assistance, those are individuals that in the past would not have been covered in a situation like this. Over $513 million put forward, and you can see the overwhelming majority of that over just the last 2 weeks. I want to say thank you to the hard-working men and women in the Department of Economic Security. We continue to make progress. This week alone, we've paid out over $188 million in unemployment insurance benefits and $218 million in pandemic unemployment assistance. DES has served over 700,000 Arizonans. 572,000 plus with unemployment benefits and 139,000 plus with the unemployment assistance for the pandemic. I know that there have been complaints, and I know that there have been frustrations, and we've worked hard to expand capacity, resources, servers, employees that are working there. They work through the weekend, Sunday and Monday of Memorial Day, but over 700,000 Arizonans have been served. There are more that need to be served, and we will work to do that and to get this right, but I want to recognize their effort because it has been extraordinary.